Hello, hello. My name is Jones, and today we are going to talk about eating disorders. Okay, so eating is a very important aspect of human life and human beings, and not only is it an important aspect, it is necessary for survival. Okay, Okay, it's necessary for survival so that we replace worn out tissue, we nourish our cells. Okay, and eating is a social activity that has been part of us for many occasions in our lives. For some individuals, eating is one source of their worries, anxiety, and a problem. And this is where this topic comes in, eating disorders. Many people are worried and apprehensive about how they look. Most of the time, they can feel self conscious about their bodies. Amongst the population, the teens are the ones most concerned about their body figure. This can be true, especially that they are going through puberty and they undergo dramatic physical changes and face social pressures. Okay, so by definition, when you're talking of eating disorders, it refers to a group of conditions that are described and typified by abnormal eating habits that are involved within this condition. The food intake in this case are either insufficient or excessive and may result in detriment of an individual's physical or emotional health. Okay, so some of the common eating disorders that we have include anorexia nervosa, bulimia nervosa. We also have binge eating disorder. Then we have paging disorder, and then we also have pica. Okay, so when we say anorexia nervosa as the one common eating disorder, it is a life-threatening eating disorder that is characterized by clients' refusal or inability to maintain a minimally normal weight, okay, with intense fear of gaining weight. Clients with anorexia nervosa have a disturbed perception of the size and shape of their body. The people that have anorexia nervosa have body weight that is 85% or that is far much less of that expected of their age and height. Anorexia can cause menstruation to stop. It may also lead to loss of skin integrity and may lead to necessarily heart problems. Okay, this is because it greatly stresses the heart and increases the risk of heart attack and other related heart problems. So the risk of death is greatly increased in individuals with this disease. Okay, so that is anorexia nervosa. Then we also have another common eating disorder, which is bulimia nervosa. Bulimia is characterized by recurrent binge eating followed by compensatory behaviors such as paging. So when you're looking at bulimia nervosa, this is a self-induced vomiting. When you're looking at paging, is self-induced vomiting and excessive use of laxative or diuretics, or one may engage in exercises. So that is the paging. So in bulimia nervosa, the condition is characterized by recurrent binge eating a lot. Okay, then afterwards, after this eating a lot is compensated with the behaviors of trying to digest or trying to remove out that food, that one that has eaten. So they may induce vomiting or may use laxatives to remove out that food, or diuretics, or use they can excessively do exercises so that the food that they have eaten can be used up. So the amount of food consumed during a binge episode is quite larger than necessarily what a person normally eats. Bulimics may also fast for a certain amount of time following a binge eating episode. Clients with bulimia Bulimia, binge because of strong emotions, which are then followed by guilt and shame. Okay, so when you're talking of bulimia nervosa, we're looking at a condition that is characterized by recurrent binge eating with a compensatory, followed by compensatory behavior of paging. Then we have binge eating disorder. So from bulimia nervosa we have binge eating disorder. So this is a type of eating disorder that is characterized by compulsive overeating. But in comparison to bulimia nervosa, there is no compensatory behavior that is noted after this binge episode. So this is known as binge eating, where one eats a lot, but they do not make effort to reduce the food content that they have eaten through exercises or inducing vomiting. So this is known as binge eating disorder. Okay, then we have paging disorder. Okay, these are individuals who are in the certain eating disorder. Okay, but when you say someone has a binge disorder, these are individuals who are eating normally, but they currently paging to promote weight loss, and these are people that we may look at to be under this category of paging disorder. So they will eat normally, but they currently do some kind of paging, let's say excessive exercises, in order for them to reduce weight. Okay, then the other eating disorder that we can talk about is pica. Individuals who cannot distinguish between food and non-food items have pica. In this type of eating disorder, a person is craving to eat, chew or lick non-food items or foods containing no nutrition. These things may include chalk, paper, plaster, paint chips, baking soda, starch, glue, rust, ice, coffee grounds, or cigarette ashes. So these are people who have pica, that eat non-nutritive substances, or have a crave to eat non-nutritive substances. So today we have been looking at eating disorders, okay, which is a very important topic and a very important item to do with every human being. Eating is a social activity, okay. So for some individuals, they feel worried when you are talking about eating. They become anxious, or for them it's a problem. So that is why we have talked about eating disorders. So the eating disorders that we have looked at is anorexia nervosa. Okay, anorexia nervosa is a life-threatening eating disorder characterized by clients' refusal or inability to maintain a minimal normal weight, and there is intense fear of gaining weight. Okay, so there are some examples that I can try to give, but I might offend maybe some people, because when you talk about some people who are famous and they had anorexia nervosa, you may cause some problems. So otherwise, anorexia nervosa, simply know that these are people who are afraid necessarily to eat, okay, and they lose a lot of weight, what is below their weight requirement. Then bulimia nervosa, okay, these are people that they currently eat, but have a compensatory behavior of paging or self-induced vomiting or excessive use of laxatives or excessive exercises. This is to counter the overeating that they do. But the amount of food consumed during the binge episode is necessarily quite larger than the compensatory methods that they may engage in. Then binge eating disorder, in here there is eating a lot but no compensatory activities or paging activities that may happen. Then paging disorder, here a person just eats normally but recurrently do some paging to promote weight loss. Okay, so then pica, this is a craving for non-food substances, and individual would want to lick them, chew them, or eat such things. So that is necessarily our topic on eating disorder. Thank you very much and keep studying.